layers of skin being scraped off. Normally, all you need to do is clean and dry the cut, apply some pressure and raise the injury. This should help prevent infection and stop bleeding. The wound should heal by itself within a few days. When treating a cut, always wear gloves if you have them, and first ask the casualty to apply some pressure to the wound using a piece of gauze. Just put some pressure on there and then raise the injury. Next, you need to clean the wound. And gently dry it. And finally, apply a sterile dressing. Just remove the gauze. Brilliant. Remember, apply pressure, raise the injury, clean and dry the cut, apply a sterile dressing. If you're worried about infection, ask the casualty to seek medical advice. And that's how we treat a cut or
something
a
very
graze.
minor, such as getting shampoo in your eye, to something quite serious, such as a cut, which could cause permanent loss of vision. Common types of eye injuries include foreign objects getting stuck in the eye, cuts or grazes from a sharp object, severe blows to the eye from a hard object. If you think someone's hurt the eye, there are 5 key things to look for. Pain in the eye or eyelid, a visible wound or bloodshot appearance, partial or total loss of vision, blood or clear fluid leaking from a wound, screwed up eyelids and watering if there is something in there. If someone has an eye injury, tell them not to rub the eyes as this can make it worse. Get them to sit down facing a light. We're going to open the eyelid. Get them to look right, left, down, and back. If you see something in the eye, get them to tilt to the injured side. You can use a jug of water or saline solution to remove the object. You can use a tea towel to get any drips that may come from the eye. If you think the eye may be bruised or cut, get them to lie on their back, keeping their head and eye as still as possible. You can give them a non-fluffy sterile dressing to hold in place over the eye. Mark, could I get you to just place this over your eye for me? Excellent. Or you can keep it in place with a bandage. Then take or send him to hospital. So remember, when you're treating eye injuries, tell them not to rub the eyes. Look closely to see if there's anything in the eye. If there's something in it, wash it up with clean water. Put a pad on the eye if it's bruised or cut, and take or send him to hospital. And that's how you treat.
In an asthma attack, the muscles of the air passages in the lungs go into spasm. This makes the airway narrower, making it difficult to breathe. This can be triggered by an allergy, a cold, or smoke. At other times, someone may have a sudden attack with no obvious trigger. If you think someone is having an asthma attack, there are 5 things you may see. They may have difficulty breathing or speaking. They may be wheezing. They may be coughing a lot. They may be distressed, anxious. They may have a gray-blue tinge to their lips, the earlobes, or the nail beds. People with asthma usually know how to deal with their own attacks by using their reliever inhaler, usually with a blue cap at the first sign of the attack. But if they don't, or if the attack is severe, you may need to help. When treating someone having an asthma attack, keep calm. Reassure them and advise them to use their reliever inhaler straight away. Advise them to use a spacer if they have one. Amy, use a spacer with the inhaler. Yes. Yeah, well done, well done. Ask them to breathe slowly and deeply to help control their breathing. Sit them down in a comfortable position. If it doesn't get any better within a few minutes, it may be a severe attack. Get them to take 1 or 2 puffs of the inhaler every 2 minutes until they've had 10 puffs. If this is their first attack, the attack is severe, they're not getting better, they're getting worse, or they become exhausted, call 999 or 112 for emergency help. Help them to continue to use the inhaler as needed. Keep checking their breathing, pulse, and level of response. If they do become unresponsive at any time, treat a casualty who is unresponsive. So remember, reassure them. Help them to use their reliever inhaler. If the attack is severe, call 999 or 112 for emergency help and monitor their level of response. If they become unresponsive, treat as an unresponsive casualty. And that's how we help someone with an asthma attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Sunburn is caused by overexposure to the sun, a sun lamp, or overexposure to radioactivity, although this is extremely rare. We can avoid overexposure by covering the skin with clothing and wearing sun cream. If you think somebody may have been sunburnt, there are 3 things to look for: reddening of the skin, pain in the area that's been burnt, and blisters. Encourage them to take sips of cold water, cool the area down by sponging them with cool water, or soak the sore skin in a bath or a shower for no longer than 10 minutes. You can repeat this if it helps ease the pain. If the burn doesn't blister, then the sunburn is mild and you can treat with calamine lotion or after sun to soothe the sore skin. If there are blisters or other skin damage, then the burn is severe and they will need to see a doctor. You will also need to look out for symptoms of heat stroke and heat exhaustion, as these can be life-threatening. Remember, cover the skin, take sips of cold water, cool the skin. If there's no blistering, then use calamine lotion or after sun. If there is blistering, seek medical advice. And that's how we treat somebody who's suffering from sunburn.
Cracking a bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes a bone can puncture the skin. This is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack, or bend quite easily, a bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in an unnatural direction. The limb may look shorter, twisted, or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength, or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area, use a sling or triangular bandage to keep it secure, cover any wounds, call 999 or 112. And that's how you treat someone with a fracture. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk.
Shock happens when the important organs in the body, such as the heart and brain, don't get enough blood or oxygen. Your baby can suffer from shock if they've lost a lot of bodily fluids. This could be from diarrhoea, vomiting, burns or dehydration. Your baby may also suffer shock if they have had a severe allergic reaction, a severe infection, or if they are bleeding heavily. If your baby is in shock, you might see some of these signs. They may look pale and unwell. Their skin may be cold and clammy. Their breathing may be fast and shallow. They may not be feeding or urinating. They may make a grunting noise when they breathe, or they may yawn or sigh a lot. They may appear confused and not respond as normal. In severe cases, they may become unresponsive. If you think your baby is in shock, call 999 or 112 for an ambulance. Explain that your child is in shock and what you think caused it, such as bleeding, diarrhoea, vomiting or an allergic reaction. Lay your baby down with their legs raised higher than their chest. Support the legs on something like a cushion or a rolled up blanket. Do not leave your baby on their own. Loosen any tight clothing around their neck, chest and waist. Keep your baby comfortable and calm, as fear or pain can make shock worse. Keep checking your baby's breathing and pulse and whether they can respond to you. If they become unresponsive at any point, open their airway, check their breathing and prepare to do CPR if necessary. So remember, call 999 or 112 for an ambulance. Keep your baby's legs raised above their chest. Keep them calm and comfortable. Keep checking their breathing. And that's how you treat a baby for shock. Thanks for watching. Help support St John Ambulance. Donate today.
When there's something wrong with your baby, if you know what to do, you'll give them the best chance of survival. If you've found your baby is not responding to you, you'll need to do a primary survey. If they are breathing, try to keep calm and put them into the recovery position. This is the safest position for your baby until help arrives. Cradle your baby in your arms with their head tilted downwards. Then call for an ambulance. Keep checking your child's breathing, pulse and level of response while you wait for help to arrive. And that's how you put a baby in the recovery position. Thanks for watching. Help support St John Ambulance. Donate today.
You should use a sling to stop someone's arm moving to protect it and prevent further damage. There are two types of sling, an arm sling and an elevation sling, and both can be made using a triangular bandage. The difference between these two types of sling is that an arm sling holds the arm in a horizontal or slightly raised position. It treats upper arm injuries, wrist injuries, somebody who can bend their elbow, and also for a rib fracture. An elevation sling holds the arm in a raised position with the fingertips touching the shoulder. It can help support the arm. It can also help control bleeding from the hand or the arm and also help to reduce swelling. To make an arm sling, ask the casualty to support their arm. You just hold it for me. And then use your triangular bandage and gently pass it underneath their arm and over their shoulder. And leave the long bit facing down. Then bring the top bit around to the opposite shoulder, and the bit that's hanging down, bring that up to beat it. If you just let go of your arm for me now, and then re-support it. Lovely. Just tie a reef knot. And then tuck the corners underneath. And make sure the whole of the arm is supported, down to the little finger. With the bit that's left over, just twist it until it becomes nice and tight and it snugly fits in around the elbow. To make an elevation sling, first ask the casualty to support their injured arm. If you just support it there for me, and their fingertips should be touching the shoulder. Lay your triangular bandage over the injured arm. Just get the casualty to hold it in place. If you just hold it there for me. Come underneath the arm, around the back, and then tie using a reef knot. And then just tuck the points under. With the bit that's left over, just twist it until it's nice and tight and it fits snugly in by the elbow. To check circulation, you need to squeeze the fingernail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the sling is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, there are 2 types of sling. You need to know which one to use for each condition and how to apply them.
If you ever find your baby is not responding to you, you will give them the best chance of survival if you know what to do. If you have found your baby unresponsive and not breathing normally, you will need to perform baby CPR. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs covering both the nose and mouth, then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you do baby CPR. Thanks for watching. Help support St John Ambulance. Donate today.
We'll teach you what to do if you found someone collapse. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A. Alert. V. Response to voice. P. Response to pain. And U.
Is the casualty unresponsive to stimuli? If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk. If after performing the primary survey, you find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand center on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing Staying Alive. After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive.
They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask a caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/.
If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call for help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available, while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting their head back with 1 hand on the forehead and 2 fingers under the chin. Pick out any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this. To do chest